project we had with a hospital that's in the Midwest, near the Great Lakes actually. And this hospital is about 203 beds with an emergency department volume of roughly probably 40,000 patients a year. This hospital requested some assistance with us for a vacancy in their emergency department for their director position. The request was, please help stabilize ED operations on a day-to-day basis. We also wanted to focus in on helping to make sure that we had positive leadership in the department. They were building a culture improvement, building morale with the team, focusing on team, empowering the staff to help own their work. And as we worked through that, we also recognized that there was a gap between nursing and physicians in terms of how they function together and how they work together. So I wanted to focus in on that area as well. With that work that we did and really working to get that positive environment in that department, we actually grew a leadership team of charge nurses. So we didn't have really a strong charge nurse group. They had anybody on the schedule could be the charge nurse. And so by giving them a consistent program, this is what charge nurses do, this is what the roles are, we were able to reduce that operational variability and really improve and drive performance and staff engagement. The staff were feeling like they were involved in the process improvement and a part of it, feeling like they were then able to help make these positive changes happen with a voice. As a result of this, or maybe during this process, I should say, we implemented safety huddles, which really hardwired on day shift and night shift both, to make sure that the staff have a forum to receive timely information, both on emergency department as well as hospital-wide events from a safety perspective. And then the emergency department metrics were also reviewed daily to make sure that everybody knew how they were performing, what the goals were, and what we were working towards. This really helped to improve their involvement in this work as they helped to identify opportunities. The staff education really about patient experience also had a big improvement. A lot of the staff had worked there a long time. And so really helping them understand kind of the trends in terms of contemporary nursing practice and how we see quality, including patient experience. That viewpoint of patient experience being a quality measure is important in the emergency department, and they really were struggling with that aspect. Some of the results that they were able to achieve, they actually, from January until July, they were able to move the patient triage times from an average of 22 minutes in January to 11.9 minutes in July. So door to triage complete times decreased from 22 to 11.9 minutes. We also decreased the average time that we had patients from bed arrival time to the time they were in their bed from 27 minutes to 12 minutes in July. So starting in July, patients were in the rooms in 12.6 minutes with triage complete and ready to see the physicians. The average discharge length of stay also decreased from 205 minutes in January to 192 minutes in July. A lot of this was time spent in the waiting room when the patients first arrived, so not value added for the patient at all. So significant improvement in throughput. While we did this, we actually were able to keep our times for patients leaving before treatment complete, so including AMA, elopement, and also left before triage, was below 2% throughout the entire time based on national average. They were having an average of 12 complaints a month that were formal complaints back in January at the beginning of this. And by the end of this project, they were down to 4 complaints a month. So significant reduction in complaints. One of the other really surprising and kind of exciting things that happened as a result of this project is that we actually were able to decrease falls. So emergency department falls are a problem for most hospitals. And this hospital actually decreased the falls year to date from January to August. This department had a total of 5 falls. Those were not falls with injury, they were just falls. So 5 falls, no injuries, which is very, very impressive. So very excited to say that fall trend with the focus on safety, the focus on really being in the room with the patients, spending the time with the patients, really decreased the falls as well. We were able to actually mentor and grow the operations leader into the position of the director of the department. So really excited that she was able to achieve this new role, and things are going very, very well as we've left.